Joining us from New York is Monica Knoll, a breast cancer survivor, founder of a website called cancer101.org, and the developer of a planner. I apologize for referring to it as a calendar. It's much more sophisticated than that. A planner for women when they get diagnosed with cancer. So I'm going to not make any more mistakes, and I'm going to let you, Monica, explain exactly what this is all about.
Hi, Dr. Johnson. Thank you very much for inviting me on your show. Cancer 101 created, I created a comprehensive 10-year breast cancer planner to help women and caregivers take control of their diagnosis, to really empower them from the moment they hear the words they have cancer all the way through to manage their follow-up care really through the next 10 years.
And since you're doing this planner over a 10-year period, how do you allow for the variations that will occur from one individual to another?
The planner is really developed for any type of cancer. Most of the information inside the planner is really about an organizer. We don't have any time-sensitive medical information in the planner. It's really about how to get through the experience. Every year we update the planner. The information is also on the website, and we allow the patient, the recipient of the planner, to mail in a card to request updates of content. But most of the content is very, resources, nothing non-medical, nothing medical.
And if I remember correctly, you have also been diagnosed with ovarian cancer?
Yes, 7 years ago I was diagnosed with breast cancer, which is what inspired me to start Cancer 101, and by the time I was ready to launch our program, I was diagnosed a year ago with ovarian cancer, and I actually had an opportunity to test pilot my own program. And so I can say firsthand that the planner really helped me, as I know it has helped so many other patients already, take control and stay on top of all the information that you receive once you hear the diagnosis.
And are you saying that it really would be applicable to most any cancer in terms of talking about the course and resources necessary?
Specific to breast cancer, absolutely. It's really, it's very user-friendly for any type of breast cancer. We eventually, which is why I picked the color green, plan to design and develop the planner with additional funding for other types of cancers.
I must say, one of the things that struck me when I first read about it this morning earlier was the 10-year mark. I suspect that in and of itself offers a lot of optimism and hope to people when they think about using it.
Absolutely. I think that is, I've heard that is one of the nicest reactions to the planner, that when someone hears about a breast cancer diagnosis, that, gee, I'll be around to use it for another 10 years. And absolutely, as we all know, now that there's so many wonderful medical advances in breast cancer, certainly most breast cancers are treatable, and it's important for the patient, the person with breast cancer, to really take control of their health and the responsibility of managing their own follow-up care, and that includes the follow-up doctor's appointments and eating well, exercise, and this planner really helps patient, it helps the person with cancer and the caregiver really manage the process.
Well, again, I will remind our audience that we are talking about a website called cancer101.org, where you can get more information about what Monica has been describing. And we thank you, Monica, for taking the time to join us this morning.